Hi everyone, welcome to the second and the final day of the series of the Ayurvedic Woman with Mary Thompson. And today I want to begin with a note of gratitude. First for everybody, all of you who've managed to come here today, and for all of you who were there yesterday, who were present with us, and who sent in such great feedback. I think the first thing we must appreciate is the fact that people are getting more and more conscious and they're ready to take these small little steps towards their health and well-being. So that must be appreciated. In yesterday's session, we covered a lot of the different symptoms of menopause, and we covered a lot of, we took a general introduction. We began with an introduction to the Ayurvedic concept of women's health. Today, we have some 4 or 5 specific concerns which we will take up. And as we have more and more people join in, thank you so very much for taking out time and making this effort to be here with us. Mary? Hi, we were just checking if you're still there, and so as we'll just wait for a couple more minutes for more people to join in. I must tell you that the response has been very, very good. People have written to us with a lot of appreciation of what you've shared, and thank you so much for being able to do this with us.
Oh, that's wonderful. That's wonderful. I'm glad that people are finding some good information for themselves and for their family.
So today, the first 4 or 5 things that we will talk about today are, first is breast health. And you know, this is something which we usually don't notice. It passes off as another everyday thing, but breast tenderness, disfiguration, and also being conscious about breast cancer. How do we ensure that, you know, we are taking enough preventive measures for breast cancer? Then our next topic is going to be something that we definitely don't discuss a lot, which is vaginal health. And this is something which is very easy to do, which is what I understand. And Ayurveda gives us a very nice perspective on that, on how you can take care of your vaginal health yourself. And then another very common but very troublesome, painful symptom of any kind of hormonal changes is anxiety and depression. We'll cover that. And lastly, today we'll have Mary talk about something which was quite a topic yesterday, but we couldn't give it enough time, but we'll give it some time today. So we have people joined in here. Mary, let's start with breast health. What does Ayurveda have to say about taking care of breasts?
Well, when we look at breast health, first let's talk a little bit about the doshas and the breasts. Typically, Vata dosha is underdeveloped, and so people of Vata nature tend to have smaller breasts. They don't have as much fatty tissue, they don't have as much lymphatic tissue, and so they may tend towards smaller breast tissue. Someone of Pitta nature women are very fortunate. They tend to be very proportional, meaning that their breast size matches their body frame size, and so they end up having good moderate sized breasts. Kapha dosha, having just more tissue, tends to have larger breasts. They tend to have more fatty tissue, more lymphatic tissue, and we see that in the breast tissue as well. So when we think about the doshas and breast health, that would mean that Vata has to make sure that breast tissue stays moistened. Vata needs to make sure all their tissues stay moistened. Pitta nature needs to make sure that their tissues don't become inflamed, because heat is a quality of Pitta dosha, and that can be something that impacts breast health as well. Kapha dosha has to make sure that the lymph isn't stagnating in the breasts, because Kapha nature has a tendency towards fluidic qualities and stagnation. So if we start first with Vata dosha, so what does it mean to keep the breasts well hydrated? Well, it means to keep the body well hydrated. Make sure that you are taking enough water and taking enough oil with food. One of the mainstays of an Ayurvedic daily routine is a practice we call abhyanga, which is a body massage. So taking a small amount of oil every morning and massaging it into the tissues of the body. We do that for the whole body, and we do it for the breasts. When we massage the breasts with oil, we do special care to make sure that the lymph, the fluids inside the lymphatic ducts, is moving. Because when that tissue stagnates is when we end up getting inflammation, and possibly getting breast cancer. So every morning, as part of a daily routine, Vata Nature wants to make sure that they're using self-massage head to toe and not neglecting the breasts in that self-massage, doing circular motions around the breast to make sure that lymph fluid can move. Also making sure that we're not wearing constricting clothing that is going to block the flow of lymph from the breast is very important for all doshic types. Vata's challenge is usually one of dryness, so making sure that if the body doesn't go to dryness, the breast tissue won't go to dryness either. Pitta dosha's particular problem is usually one of heat and inflammation. So someone of Pitta nature wants to make sure that the whole body stays cool, to make sure the breasts stay cool as well. This could be by drinking cooling beverages, like red clover tea or hibiscus tea. This would help keep the body system cooler and keep the lymph cooler. That's going to help keep breast tissue cooler. Pitta dosha doesn't have too many problems with the breast, but Pitta nature people should still be doing the daily abhyanga as well. Pitta doesn't tend to like as much oil as Vata does, but I heard that Transformative has a lovely pomegranate breast oil that they sell. It's one of those that you can use to stimulate flow through the lymphatic ducts for all three doshic types, and it's something that would be beneficial for Pitta dosha as well. So Pitta's doing the morning massage, making sure they don't have any inflammation, and if they feel heat in the breasts, cool down the whole body. Kapha dosha also wants to be doing breast massage. They're going to be concerned, though, with less oil. They might do no oil on the body, and to keep the massage going, to stimulate the flow of the lymph. They do a more vigorous massage at the breast to stimulate the flow of the lymph and make sure that they're not stagnating lymph. All three doshic types, like I said, want to watch that they're not overly binding, like wearing underwire bras that are too tight, that are restricting the flow of lymphatic tissue. You can, by doing the daily massage, you move the lymph, and then no restriction allows it to move freely back into the lymph ducts. Then you talked about specific problems with breasts, like breast pain. Breast pain may occur for any number of reasons, and usually we've got some flow of stagnation in the breast tissue. So again, the massage is going to be beneficial, but I might put a little bit of castor oil in with the massage oil, because castor oil helps break apart any blockages that might be forming in tissue. And so one thing, though, with castor oil is be sure to warm the oil up. If you don't, it seems like a very sticky oil. The pomegranate breast oil, again, is a good recommendation there to make sure that flow is happening through the breast tissue. Disfiguration in the breast, any kind of disfiguration in the body is usually Vata dosha. And so we'd want to pacify Vata all throughout the body if we were seeing any kind of disfiguration with breast tissue. And not to push this breast massage too far, but breast massage will also help to stabilize and remove any disfiguration in the breast by removing any blockage in the flow of tissue that's preventing the breast from being well formed. One challenge women often have premenstrually is breast swelling and tenderness. And this is a hormonal issue. When we go into that estrogen dominance, where there's too much estrogen in relationship to the progesterone, this usually occurs in the week before menstruation. The breasts can become swollen and tender. The only way to really address that is to see what we can do to get those hormones back in line. And I talked about that a little bit yesterday. But the biggest thing we do to get the hormones back in line is to make sure that our digestive system is good, that we're eating clean foods, we're taking in whole, fresh, local, organic foods as often as possible, that we're getting enough water, we're getting enough exercise. And we want to make sure that the liver has plenty of time to clear the blood. And so we look at our stress levels. We look at how well are we sleeping, how we can manage the stresses in our lives. Because these factors are greater players in the management of our hormones than anything we might try to do hormonally. So if you find yourself subject to breast discomfort in the week before menstruation, you would look towards the rest of the month and say, what can I do to better manage my health during the whole month so that I don't go into this hormonal imbalance right before menstruation? So breast health is body health. It's saying if I have any area of my body that's giving me pain, I want to look back and say, how can I better care for this part of my body? The way we care for the breast is with breast massage and then taking care of the whole body.
That's quite interesting. Actually, what I feel is in Ayurveda, any problem, if it's a liver problem or if it's a, the problem of one part is the problem of the entire body. And until and unless the whole body is in sync with, your routines are taking care of everything, something or the other is going to go wrong. And this is where it's so helpful to follow the right routine for you.
Mm-hmm. It certainly is, and it's something I say in class often, which is, when you have a problem somewhere in your body, you really have that problem everywhere in your body. The only time that's not the case is when you've had a traumatic injury. If I break my leg, it's only my leg that is broken, not the rest of my body. But if I end up with a cold, it's my whole body, and that cold virus is traveling through my entire body. And so I have to treat it with a holistic approach. I can't isolate that treatment and just blow my nose and think the cold has gone away. And so when it's something that's happened from my own actions, I have to look at it as a holistic problem.
About wearing constricting clothing, this myth is eternal, and you never seem to get one answer to whether you should sleep with your bras on, or you should not wear them or not wear them. And there's just so much debate about it. And there was so much of confusion about whether it even causes cancer. So what is the Ayurvedic take on that?
I don't know that there is a specific Ayurvedic take on the wearing of bras, because the bra is more of a modern invention. If one wears something at night that allows free movement of the lymphatic fluids in the body, then that's not going to be a problem. The problems with constricting types of bras that might be tight, if you take your bra off and you see red lines across the midsection right underneath the breasts, then it's constricting the flow there. One study I was looking at linked breast cancer rates were increased about 600% in women who did wear bras at night. So they were looking at the blocked flow of lymph was a factor in this study. So, and I think it just makes sense that when we're a fluidic body, 80% of our body is water by weight. So we've got all of this water in the body. If we stop the flow of that water when it's not supposed to be stopped, we have the possibility of stagnation in the system, and that stagnation is where we can breed bacteria, and we can breed viruses, we can breed fungi, we could have problems in the tissue. So it makes sense to me that the lymph needs to move. But there are many types of bras that are out there that a woman could sleep with that wouldn't be constricting to the body. And the best way to check, like I said, is just see, does that bra that you're wearing leave those lines? Is it cutting into the flesh in a way that's blocking flow? Ayurveda typically would say, when something is supposed to move, you support its movement. And when something is not supposed to move, you stop its movement. It's that law of inertia. But when we look at our body, the fluids in our body should be able to move at all times. When they're stagnant is when we have a problem.
Great. So that's helpful, that you could wear bras, but wear those that are not constricting.
Mm-hmm.
Right.
So many people want to wear the bra because they think it improves the quality of the breast tissue and it helps the breast not to sag or something like that. And the sagging of the breasts, unfortunately, is something that happens oftentimes after pregnancy because of the shifts that occur in the body during pregnancy, that for some women, it doesn't make a difference if they wear a bra or not. They're going to have less muscle tone in the breast tissue.
So breast massage will help in that as well, you think?
Well, breast massage is really great for a couple of different tissues. It's good for the plasma, the rasa, because it supports the movement of the plasma. It's also good for the muscle and the skin. The skin is a part of the muscle tissue. And so by making sure we have the fluids moving, we avoid trapping any impurities in the skin, and that's going to leave us with better skin tone as well. So definitely it's something that would support more, I try not to use words that I haven't explained, but astringency, which is the holding of tissue. It supports the astringency and better muscle tone and better skin tone.
Okay, great. That's helpful. Carol here asks, for kapha, a dry brush massage would be better than oil massage?
A dry brush massage is good for kapha dosha especially because it's stimulating to the movement of lymph. And so they can do that. It's always when you're doing a lymphatic massage, you're brushing in the direction of the heart. And when using a dry brush, it does stimulate. It's going to break off more or cause more exfoliation to those upper levels of skin, increase circulation, and that's going to increase the removal of any toxicity from the body. So Kapha does very well with a dry brush. They also can do silk gloves or exfoliating gloves and do that massage with a silk or exfoliating glove. And that will warm up their body, bring their own oils to the surface, so they don't need to use any external oils at all.
Great. So that's about breast health. Now let us move on to vaginal health, and that is one topic which is so related to menopause and menstrual issues. Let's first start with the years of fertility, and it is not so much about the vaginal health, but about reproductive health in general. What about discharge? Some women go through some discharge before or after their periods. What would you say about that?
Well, the vagina is a self-cleaning organ, first of all, meaning that it shouldn't need any extra washing. It does allow for the movement of the fluids out. If there was some type of discharge that smelled bad, then that's an indication that there is an infection in the vagina. And so a person would want to find out, what's the cause of the infection? And there are many different Ayurvedic types of recipes for vaginal douches to wash out and support the body in ridding itself of the infection. This gets to the point, though, that I made earlier, that when you have a vaginal infection, your whole body has an infection. It's just that the place that it's manifesting is in the vagina. So what we would look at is doing things to wash the vagina to make sure we could remove any bacteria or protozoan or something that's in there that's causing a problem, but at the same time taking something orally, an herb that will support removing that imbalance from the whole body. I had a woman one time that didn't realize that we naturally have a discharge that moves out at ovulation. It moves along with the egg, and it's clear and a little bit sticky, a little bit, I guess, more slimy. And so she was concerned about this discharge she was seeing, and I said, no, that's one you're supposed to have. So tracking the times when you see discharge could be important for you to understand if this is a natural discharge, which comes at ovulation, or if it's more an indication that you might have an infection of some sort. And what you'd be watching for any kind of discharge to indicate that it was infectious would be if it had any coloration to it, yellowish, greenish, or if it smelled. And when you have yellowish, greenish discharge or it smells, you have some type of vaginal infection. And so you could work with herbs that would clear that away.
Okay, then complaints or concerns like candidiasis are pretty common. There are yeast infections and things like that. They're mostly external, and mostly people use ointments in those cases. Are there any other recommendations that you would make in those cases?
Well, with Candida, we've got the overgrowth of yeast, and if any woman's had a Candida overgrowth, she knows how uncomfortable it can be and the intense itching that can come along with it. So certainly treating locally with something that's going to remove the yeast from the vagina is important, because that's going to give you some relief to that itching and to the direct complaint of the inflammation of the tissue. Candida, though, begins in our body in the gut. So I'm back to my digestive system again and saying what I want to do is make sure that I don't have an overgrowth of yeast in my small intestine, and if I don't, then I can't have it show up somewhere else. This is a perfect example of another case of, although the imbalance is showing itself in the vagina, it begins up in the digestive system. Spicy things like cinnamon, cardamom, ginger, these all help to raise the digestive fire, and that helps to minimize the yeast presence in the gut, which helps to minimize the symptoms that one's experiencing externally. Aloe vera gel can be applied externally to help with alleviation of the symptoms. But then I would look towards my diet and I would see, are my foods really acidic? Do I have too much coffee, sugar, alcohol, sodas, or meat in my diet? Those things are really highly acidifying, and they create the perfect environment in your small intestine for yeast to overgrow. So I'd have to look back to my diet to see what I could do to get rid of the yeast. One of the key things, though, in working with women who are in a relationship and are having repeated Candida infections is to have their partners treat themselves as well. So when a woman is sexually active, if she has sexual intercourse and she has Candida, her partner now is carrying the yeast externally. So after a shower and before intercourse, putting aloe vera gel, or for a time, certainly wearing a condom, something so that they're not transmitting candida back and forth. Men don't experience the same symptoms of candida that the women are experiencing, so they don't think they're carrying the yeast, but they can reinfect their partner, and that can be very debilitating for a woman who continually gets yeast infections and doesn't realize that she's being reinfected with the yeast each time.
Okay, so are there any herbs that you recommend for it? Apart from aloe vera gel, is there something else that you think can help?
Well, one of my what I consider a magic treatment. I consider this magical because it does alleviate the symptoms and it's very easy to use, which is using the aloe vera gel. You take about 4 ounces of aloe vera gel and you put 20 drops of an essential oil in there. The best is marjoram. If you can get marjoram essential oil, put 20 drops into the aloe vera gel, and you can apply that vaginally, or the man can apply it externally to his genitalia. And this will destroy the yeast at the site.
Wow.
If you don't have marjoram, tea tree works very well. And if you don't have marjoram or tea tree, lavender. But marjoram is the best. It tingles for a minute, and then the tingling goes away. And I've had women report they get 4 to 6 hours of relief from symptoms with that. So I'm really a big fan of that treatment. And also with having the man use that after a shower or before intercourse so that they're not reinfecting their partner.
Wow, that sounds pretty quick. Even ointments and all are not, they take some time to create a difference.
Mm-hmm. No, this was, I consider it almost magical, the way it works. But at the same time, it hasn't, we talked about this yesterday, I can treat the symptom, but I haven't gone to the cause. So that may take care of my symptom. I still have to look and see where am I creating the candida in my digestive system and make sure I'm paying attention to that.
And I was going to come to that candida starts in the gut. Now, if you're having a vaginal infection, you don't think of what you're eating at all because that's just not how we're conditioned, and it's a new one. So what, you mentioned some spices can help in digestion, but taking care of discharge and other things, are there any specific dietary recommendations for different doshas for this?
Well, candida is particularly prone towards kapha. So it gives us an indication that we have a weakened digestive fire. And usually what we do is we feed the candida with sweet taste. And so what someone might want to do is if they know that they have an overgrowth of candida, they want to stop feeding it. So stop taking sugar. Another thing it lives on is fermented foods, not lacto-fermented, not like sauerkraut and those things, but fermented foods like vinegars and alcohol. And so eliminating the things from the diet that the candida lives on, at the same time bringing up the digestive fire by incorporating more and more spices in the diet. These create more alkalinity in the system, in the digestive system, and the candida, the yeast, can't live in that alkaline system. This is also, it's a big thing nowadays to talk about the human biome, all those bacteria that live in our gut. And probiotics are a big part of this. In ancient Ayurveda, they included probiotics with having lacto-fermented foods as a part of the daily diet. When we look at chutneys, the first chutneys were made with fermented foods so that they could introduce this healthy bacteria into the gut. And there may be many places in India that are still producing chutneys with lacto-fermented vegetables. When we look at yogurt and curd, this has got a lot of healthy gut flora in it, and that helps to maintain the probiotic population in the gut. So Ayurveda has always been behind creating a healthy gut flora in the case of the probiotics to counter any kinds of imbalances in the digestive system. But we just call it different names now, probiotics and the human biome.
Yeah, they just sound more scientific, but the fact is that something as simple as yogurt can do the same thing as all those external probiotics. Okay, so it might be slightly deviating from what we're talking about, but this whole topic of fermentation brings to light, there are these new kinds of breads out there, non-fermented breads. Do you have any take on that, whether they're, you should take them or not?
Well, it's like sprouted breads or breads without yeast.
Yes.
Oftentimes there is some talk in some Ayurvedic circles about not taking yeasted breads because the yeast creates pockets of air and it disturbs vata. Taking the yeast, also we have bread itself is more acidifying, and so in small quantities bread is fine. I think our big problem is just the vast amount of bread that we might get during a day. In the standard American diet, you might have toast with breakfast and then have a sandwich at lunch and dinner and bread at dinner. And I think it's just that we're getting too great a volume of these yeasted breads. I personally don't like to vilify any foodstuff. I don't want to say you can never have that dinner roll. I want to say, how often are you having it, and how much of the dinner roll are you having, so that you're making sure that you're getting a good balance of all the foods. Nobody ever says, oh my gosh, I just ate way too many vegetables yesterday. I went into a vegetable coma. But I've heard people say that about bread, that you start eating one bread. I had one person tell me that they could sit down with a loaf of French bread and a cube of butter, and they'll just eat the whole thing. And then they say, okay, that probably didn't bring in enough nutrition. You might be doing it because you're getting one type of nutrition, but you're not getting a rounded type. So having it as part of the diet is not, I don't think, is necessarily bad, but it's the volume of bread that we tend to get that can throw off the rest of the nutrients that we need to get. Because bread takes up a lot of space in our digestive system, but doesn't bring in a lot of nutrition.
Okay. At this point, I'd just like to mention that, like Mary just mentioned a few minutes back, that any disorder in a certain part of the body may be influenced by a general imbalance in the entire body. And as she mentions in her course, the Ayurvedic woman, she recommends diets for different kinds of imbalances, different kinds of symptoms, the right lifestyle for different doshas, what you should do to, prevent and treat certain imbalances in the program. I'd just like to take a minute to talk about that, because the program has just been launched yesterday. And as you would be able to see on the right-hand side in the chat box, there will be a link to the course. The course is, it's just been launched yesterday. There's a 4-day introductory offer on it where you get 50% off on the price, which will definitely shoot up as soon as the 4 days end, which should be in about a couple of days, I believe. The program comes with a text companion so that you can just go through quickly, certain topics for a quick reference. It also has 3 bonus videos, one of which is tips to maintain inner sense of self. Mary, I want you to talk a little bit about that, because that sounds like an interesting topic. How do you maintain inner sense of self? We'll just go to that in a few minutes when we talk about anxiety and depression. But also, there are 2 other videos which are, Melanie and Robert Sachs's breast massage ritual, which was shared some time back. You can really follow that, since we were just talking about breast massage. If any of you would like to know how to really perform breast massage in the best possible manner, you can refer to that video. You can keep it, you can save it with yourself and go back to it whenever you'd like to. Now, coming back to another thing, that there's also free shipping and 60 days money back guarantee, so you can completely just go through it and see if it works for you. It's completely risk-free, I would say, in a manner. Mary, Pam here sends in a question about inflammation in the vagina. She says, what causes inflammation in the vagina? What is inflammation anyway? And allergies cause inflammation in the body. Do they also affect the vagina?
Mm-hmm. Inflammation is a natural immune system response. When it recognizes that tissue is damaged, then the body creates inflammation to increase circulation coming into the tissue. Women often experience inflammation in the vagina for many, many different reasons. We can experience inflammation in vaginal tissue because of a bacteria or virus that's affecting the tissue. So the body recognizes there's a bacteria or virus here. It sends inflammation to bring white blood cells to begin to fight that. So vaginal infection can cause inflammation. There may be some trauma that the body experiences. This could be through sexual activity, or it could be through some other physical activity where there might be tearing in the vaginal tissue, and the body sends inflammation as a way to repair that tissue. Inflammation is a big problem in women in menopausal years as the body becomes more dry. And so this was another topic that we were going to talk about, which was vaginal dryness. This one was one that surprised me so much because women don't talk about vaginal dryness, and I thought when I first heard about it, that meant that there was some discomfort at intercourse. But it really could be discomfort at walking, because what happens when you have dry tissue against dry tissue, there's friction. And that friction causes tears in the vaginal wall, and then the body sends inflammation to begin that repair. So inflammation can come because of an external infection, or it can come because of tissue damage through trauma, or because of tissue damage after menopause. So any of these can create that. Candida, one of the things we think about with candidiasis, the yeast infection, is the discharge. But the tissue behind that, the tissue of the vagina that has that, is raw and inflamed because the body's trying to bring itself back into a state of balance. We often talk about inflammation like it's a problem, but really inflammation is your body's solution to the problem. And so if we can fix what the problem is, we can get rid of the virus, the bacteria, repair the damage, or solve the problem of dryness, then the inflammation is going to fall away. Pitta dosha people have a greater tendency towards inflammation of tissues because they tend to be hotter, and that heat tends to break down tissue. So when we look at Pitta dosha, they often go to inflammation, and with on Pitta dosha, I have to cool down my bloodstream. And I cool down my bloodstream by, again, looking at my diet and looking at what I'm taking in. But I might also want to consider, what are my activities? Am I out there running in the middle of the day? Am I highly competitive? Do I like arguing? Am I kind of rage addicted and I get angry and that makes my whole body hotter? So I have to look at that and say, how can I cool down my body and my mind to bring that Pitta dosha back into balance? If the inflammation's been caused because dryness happened and the body sent inflammation to fix it, then I want to repair the dryness. And this is going to be done. I can do things externally to apply moisture to the vagina to decrease the dryness, and that will help decrease the inflammation. Or I can make sure that I'm hydrating myself well enough with water and oils and moist foods so that I build up moisture in the system. Kapha dosha people don't usually go towards inflammation. They're usually going to go more towards stagnation and an overproduction. So it's not a big Kapha dosha problem, but you might see symptoms like with Candida where there's inflammation and discharge. And so there you'd still be treating both, the inflammation and the discharge. You can use herbs that are anti-inflammatory, but most often you're going to look to see what's the cause behind the inflammation and see if I can address that.
Right. So there's a question here. You know, before I go to the next question, but turmeric has been reputed to affect inflammation. So if you have inflammation, if you take turmeric regularly, it helps. Would you recommend that to anybody?
Turmeric is an excellent anti-inflammatory. Turmeric is pretty much, in my mind, it's a wonder medicine. And I think this is why it's in so many Indian dishes, is that they recognize they want to be dosing themselves all day long with turmeric. Turmeric has been shown to dissolve plaque deposits in the case of dementia. Turmeric supports the liver function. It supports the movement of bile in the body. It's antibacterial, it's antimicrobial, it's antifungal, and it's anti-inflammatory. There are books written on all the ways in which turmeric is beneficial to the body. So cooking it in your food is a really good way to take it. You can also make a paste of turmeric by heating water, like you took a cup of water with, say, a tablespoon or 2 tablespoons of turmeric, and bring it to a boil. And it's going to become like a paste. And then you could add this paste to milks, you could add it to your foods, and it's a nice way to take turmeric. It adds a nice turmeric flavor to everything, and it's already been cooked. Turmeric does best when it's been heated some before you take it. So you can take it dry, but it works better in the body if it's been cooked first.
Yeah, it's generally recommended to take it with something unctuous, and turmeric with milk is something, it's very common in Indian households. People drink it regularly to boost immunity, and it's so common that you don't realize that it's therapeutic here.
Yes. Yeah, okay. And it's new in the rest of the world. We're just getting it.
Yeah, exactly. The benefits of turmeric are really, really getting very popular now, and people are including it in their diets. And again, you know, someone has a question here about a diet, the influence of diet. I just say that Mary talks in depth, in detail about the right diet, right lifestyle in the program, so you could refer to the program for that. Now, moving on to the next important concern with regards to vaginal health is, you know, vaginal dryness, and what should we do in that case?
In the case of vaginal dryness, you're at risk of damage to the tissue. And so we do want to counter the dryness, and we can do this with topical application of oils, usually oils that have been cooked with some types of herbs that have moistening properties in them.
Maybe, I'm sorry to interrupt, you were cutting out a bit. Could you please repeat what you started? We could not hear. Yeah.
Yes. So when you have vaginal dryness, you're at greater risk for actual damage to the vaginal tissue. And so we want to do something to change that. And that can be done with topical application of oils. Coconut oil is really nice for this. Sesame oil is a little bit warm and a little bit heavier, and some women like that as well. Those oils can also be combined with other herbs that are more demulcent, that have more qualities of moisturizing in them. And that would be herbs like marshmallow or slippery elm. Some people recommend shatavari, but I find that it's too estrogenic, and so some people respond in a way that's not really positive with it when you use it for vaginal dryness. It's a wonderful herb for women. However, sometimes for postmenopausal women, it can bring in too much estrogen all at once. So one thing we can do when there's vaginal dryness is treat locally. Use applications of moistening substances to provide the moisture that the body is no longer able to provide directly. The next thing we have to do is support the body to be able to provide the moisture it needs to provide, and we're back to rebuilding the tissues of the body. When I want to rebuild that tissue, that's called rasa. When I want to rebuild that tissue, it's important that I have enough fluids in the body, and that comes in with my water that I drink, that the foods I take are moist and unctuous, that they're oil-rich, that I take oils, and I could even take some of these herbs that are demulcent. And this is where I would probably bring in shatavari, or would bring in marshmallow, slippery elm, licorice root. These all have the quality of building up the tissue of the body that builds moisture. And once you've restored moisture to the body, the vaginal tissue isn't as dry, and it becomes just, less likely to atrophy and less likely to become inflamed.
Would you say external lubricants, which are not natural, coconut oil and ghees and other oils are natural, but the other lubricants available, would you recommend the use, or do you think they just make it drier and worsens the condition?
Well, again, it would be like for acute use on short-term basis. Those can be beneficial to avoid damaging the delicate tissue that has become too dry. Once the tissue is dry, we run the risk of damage to the tissue, which now the body has to repair. So acute use of a lubricant can be a benefit, but recognizing you'd go with as natural a product as you can and see what you can do to repair the problem internally by restoring the mucous membrane as much as you can through diet, because that's what's really going to solve the problem long term.
Great. So we have a number of questions on different topics lined up. I was just trying to cover the ones related to the topic first. Now there is a question about birth control pills, contraceptives. What would you say about that?
Birth control is a tricky subject because, of course, this wasn't discussed any specific type of birth control chemical that would have been taken at the time of the Charak. So any opinions that someone may say it's Ayurveda's opinion that something is Ayurveda, the depths of Ayurveda didn't have an opinion because it didn't exist at that time. What I do is I talk to people about what is it that they want and how can they get that goal met with as little invasive effect on the body. Some women decide that they need the birth control pill. What I do is I recommend that people look at one where they're still menstruating monthly, so they still have a time during the month where they're sloughing off the endometrial lining, because the body does purge out a bit with that, and so we want to make sure we're using those cleansing practices that the body has. I'm not a fan of any kind of birth control that stops menstruation completely. Other types of birth control come along with their own challenges. Things like diaphragms and use of contraceptives or condoms don't have the reliability that birth control pills have. So many women will opt for the birth control pill because of the lack of reliability of the other types of birth control. Things like a diaphragm, I just mentioned diaphragms. Things like an IUD, which is an intrauterine device where they insert it. If I talk to women who want one of those, and I opt for the one that has no hormones. the one that's not going to be having a hormonal effect throughout the whole body, but rather would just have the localized effect in the uterus. It's such a personal decision, and what I try to do is to work with women about what's their ultimate goal, and how can they get that goal met without totally disrupting everything else happening in the body. And whatever decision they make, I figure it's the one that they choose that's the best and healthiest one for them.
With birth control pills, I just like to bring up one thing that, a lot of young girls begin taking it, and a birth control pill is prescribed like that. If you have irregular menses, if you have polycystic ovarian disorder, there you take these contraceptives, and your cycle will be regular, your skin will be smooth, no acne. But
Right.
this is from my personal observation that once women want to then conceive, or even if they don't want to conceive, if they stop taking the contraceptive, the symptoms they develop, then suddenly they have their cholesterol going crazy, they have acne, suddenly they have strange imbalances when they stop taking the pill. So
Yes.
what I would like to bring to light is, before we jump to taking a contraceptive to regularize our menses, there are so many things we can do in our diet and lifestyle to achieve the same effect.
Yes.
What would you say about that?
I would agree with that wholeheartedly. And it's one of the challenges we get into when talking to a person about birth control is it's such an individual decision. And so
Right.
if it truly is about birth control, they may not have too many other options. But as you point out, it's often recommended for not birth control. One of my friends she started menstruating at the age of, I think she was 9. And by 11, they had her on birth control pills, not for contraception, but because of these intense flow that she was having. And so we would rather look and say, how could we regulate this flow so that we're not seeing an 11-year-old girl with this intense menstruation, rather than put her on birth control pills, because especially during those formative years, say during the years of puberty from 11 till 18, there's so many shifts that are going on in a woman's body that the body has the mechanisms to do these shifts naturally. We aren't as good when we're working from the outside and using a pill or these levels of hormones to try to regulate what the body is doing. So especially when women have been put on birth control pills when they're during adolescence, they struggle so much more when they come off it, because their body, during the time period the body was supposed to learn how to manage hormones in the body, it wasn't allowed to do so. And so that can be a real problem.
So we have 2 questions here. One by Pam. She asks, my daughter has polycystic ovary syndrome. She has irregular periods and acne. Any suggestions for that? Again, the whole program, I would like to mention, it covers all symptoms, and it does cover, polycystic. I mean, it covers all of this, and I'd like you to, go through it definitely. But for now, Mary, do you have a suggestion that you'd like to give her daughter?
Well, when working with PCOS, you really want to be working with a practitioner who can help identify specific causative factors in your daughter's diet and lifestyle that would help. One woman I know with PCOS was helped tremendously when she goes through cleanses. So she does yearly, puts herself through panchakarma and cleanses the body, because that helps her to manage the symptoms of PCOS. Many times there is, one woman, it was about not having enough water. And so it's so individual as to what is going to help offset the symptoms that your daughter's experiencing. And there is hope for it, but it is a disease condition that's happening in the body, where the body is overproducing cysts and the ovary is so overproducing hormones, and the body has to purify that out. One thing you'd look at is the liver. The liver is supposed to regulate hormone levels, and so when the liver is working optimally, it helps to maintain hormone levels better. So all kinds of liver support, which can be done through herbs, water, getting enough sleep. It sounds kind of silly to put it into such simple terms, but Ayurveda often comes back down to the simple question of what's in our diet, what are we doing every day, and then seeing, and after we've taken care of the digestive system and we've cleared the plasma, we've cleared the blood, we've supported the liver, then we can really see, now we can pinpoint a symptom in a specific region. And this is what I've seen in women with polycystic ovarian syndrome, is that they end up with, it's not just one approach that's going to work. It's looking at a little bit of everything. And I've seen some tremendous things. One woman who was with PCOS and worked for conception for a long time, and then was able to conceive. But it took, she had to really watch all these different aspects of her life, and it became kind of an overriding force.
Hmm. Karen here brings an interesting perspective to this. She says, I have a patient whose mother died when she was 10. Her tongue has a depression over the heart. Her menses have always lasted 10 to 12 days and is every 15 days. What are the emotional components of PMS?
Well, there's a lot of things that are happening there that may be directly related. When we look at, from an Ayurvedic perspective, we have these three bodies that we're working with. That we say the holistic approach, we might think just the physical body, but the mental, emotional body and the physical body take up that same space. When we have a depression in the heart, we have something that's lacking in the physical body, in the mental body, and even the pain is felt throughout the causal body or the soul body. It could be that she needs to go back and allow herself to grieve more fully and to love herself and parent herself to a certain extent. When you talk about she's having, I think you said long duration menses and then very short cycles, that she has long duration and then that begins again very rapidly. Was that correct?
Sorry? You just cut out a little bit.
Okay, was it correct that she was having long duration menses and then the cycles were very short, so it was 10, 12 days that she was menstruating and then menstruating again about 15 days later?
Yeah, they lasted for 10 to 12 days and every 15 days it would repeat. Yeah.
Okay, and is she going 15 days from the last day of menstruation or is she menstruating again like 3 days later? So she's producing tremendous amounts of endometrium, and I'm sorry to say, without knowing a lot more, I can't say too much apart from, we would look at it now physically, we would look towards regulation of rasa dhatu, decreasing the amount of endometrial lining that she's producing, and see what we could do to help stabilize hormone levels. Mentally and emotionally, we'd be working with kapha dosha primarily and grief. Vata dosha, pitta dosha, kapha dosha, as they come into this incarnation, we could imagine that Vata dosha has forgotten who they are. We come in completely new into this environment. We forget that we're not this body. We forget that we're not this dosha. And a person of Vata nature then thinks, wow, I could go and have all these experiences. And as soon as I get tired of having experiences, I want to go, I know that I don't know who I am, but I think if I just do enough things, I'll find myself. With Pitta dosha, forgetting my true nature, I'm born into this and I think, I could win here. I can dominate this world. I can fix everything, and this is going to give me that sense of purpose and that sense of satisfaction. Kapha dosha comes into the world and doesn't, also forgetting, not knowing their true self, but they grieve the loss. They don't know what it is they're grieving. I'll speak to Kapha dosha people and they'll say, I just feel so sad. And you say, is there something? I don't know. It just feels like it's a part of me. Now, losing her mother so young, there may be a part of her that just is still in deep, deep grief around that. And so she wants to honor that grief, but also to be able to let go a bit. And letting go of attachment is hard for Kapha dosha, but opening the self up to new experiences is really important. I can't say specifically for this person that you're describing, but that's where I would go. I would work on the mental and emotional body, in loving the self, allowing the grief to be, and letting go. In the physical body, in working with Kapha dosha, reducing the amount of rasa, increasing activity so that I'm not holding so much in the physical body. And then, depending on her spiritual practice, through prayer, through meditation, being into that soul body and trying to align herself with her true self, which is not separate from her mother and never was. And being in that connection with the highest self. And that's almost when we're encouraging our clients to go into their own spiritual practice, whatever religion that is.
Thank you, Mary. I hope that was helpful, Karen. We have another question by Geraldine. She asked, she has very low hormones, especially progesterone, and started having PVCs, palpitations. How can I rectify this other than bioidentical hormones?
Well, it's tricky. We'd have to figure out what's the driving force behind the low progesterone. There could be two possible factors driving progesterone low. There probably are many, many factors, but the two most common. One is going to be where the ovary simply is incapable of producing enough of the hormone. And that would be odd, but that could be one reason why progesterone levels were low. If that was the case, the only thing you could do would be to look for foods that are progesterone precursors, like wild yam, and other substances where you could help supplement taking some of the progesterone so that you could support and keep your progesterone levels higher, a little bit artificially from the outside. The only other possible cause of driving progesterone too low, well, I shouldn't say the only other one, another common cause of driving progesterone levels low is stress, because when we're under stress, the body uses that progesterone to help stabilize the rest of the body in its stress. So if that's a factor, then we would look there to see what you could do towards stress reduction, getting enough sleep, and figuring out what to do with the stressors in your life, that you can minimize them. I guess a third factor could be the liver. The liver does process out excess hormones in the body, and so if the liver was confused in some way about the hormone being too low, and so it kept bringing it out of the system rather than supporting the progesterone in the system, those would probably be the most common causes of low progesterone. So identifying what's driving the progesterone low, and if it's being driven low because of ovarian failure, you'd have to supplement. And that could be through food or through herb or through progesterone creams, things like that. If it's a failure of the body, if we're under too much stress, we reduce the stress. And if it's the liver, we support the liver.
Okay, we are really short of time and we have so many questions and 2 more topics to complete. But quickly, I'd just like to mention Krista, the answer. Krista asks about the initial signs of menopause. Though they are mentioned in detail in the program, Mary, if you could quickly just summarize them so that she can, watch out for those, it will be helpful.
Signs of menopause? Early signs of menopause? I hope I mentioned this in the program, but I believe that every woman of reproductive years should keep a moon calendar, which is keep a really good track of the menstrual cycle so that you can see how regular it is. Irregular menses happens for many different reasons, but what you'll clearly see is the onset of perimenopause when you keep a moon cycle, because all of a sudden the body is the hormones are no longer as responsive as they've been, and you'll start to see the cycles lengthen or shorten, or maybe this month they're short, and then a really long cycle. So you'll begin to see shifts in your menstrual pattern. These typically, you wouldn't expect to enter perimenopause as early as 35, but maybe sometime in the 40s. They're looking at this can go on for a long time as a woman's body begins to have different levels of response. As long as there are viable eggs in the ovaries, then when the hypothalamus pituitary sends the signal, the ovaries are going to start bringing an egg to maturity, and that releases the estrogen into the system. When there are fewer and fewer follicles that can respond to that signal, we end up having these fluctuations in menstrual regularity. So when the body becomes, that's probably the key sign to watch for menopause, is changes in your menstrual cycle for irregularity. There may be variations in flow. For some women, their menses get much more scanty. For other women, they get much longer duration. I talked to one woman who talked to me after she'd been bleeding every day for 6 months. Oh, sorry, I meant to say 6 weeks. Sorry, not 6 months. That would be very, very bad. But 6 weeks. And so that's kind of common with Pitta women, that they go in this long duration menses during perimenopause. So watch for those shifts. Mental and emotional. I know one of our topics that we wanted to get to tonight was anxiety. When our body's hormones are out of balance, we just don't feel right. So you might begin to notice some anxiety or some level of emotional distress that comes on as well. You don't have to experience that, but it's common that we do, because our body doesn't really understand what's going on with the shift in hormones, and we associate that with a level of emotional distress. If you have an adolescent at home, I always saw this guy taught junior high for a short time, and you can see how upset they are mentally, and they're upset mentally because of the shifts that are going on hormonally, that they don't know that something is happening in their body that they have no control over. And so they end up being more upset, but they know it's like they have this physiological feeling, and they associate it with anger, or they associate it with anxiety, or they associate it with sadness. And we're just the same. Our body's going through a hormonal shift, and we associate that feeling with an emotion. And so we can begin to recognize this mood shifts, greater anxiety, greater anger, and things like that. And when when it's not coming from outside of you, when there's not anything for you to be angry at, but you're looking for something to be angry at, then you might consider, oh, maybe I'm shifting a little bit hormonally and maybe there's something happening internal that's behind this. Apart from that, those are probably the clearest signs that we're kind of in perimenopause, those mood shifts and irregularity in menses.
Right. So mood shifts, depression, and all these things, a lot of people end up using things like Wellbutrin and other, again, like I know you don't like to say no to anything, but is there an alternative? Would you make an alternative suggestion to people to deal with depression and anxiety?
Oh, meditation, yoga. I would look at the day and see what's happening. Antidepressants, the only time I think those are a good idea, and I don't want to vilify, like I said, I don't want to vilify anything. If I'm feeling like I can't get out of bed, I want to kill myself, then I may need something for acute treatment. But typically when we look at any kind of antidepressant, it doesn't stop the cause, it stops the symptom. The cause came from my diet being out of alignment with what my desires are, with what it is my body and my highest self wants. So I want nutritious food. My body craves those vegetables. My taste buds want ice cream, but I can't live on ice cream. And so if I try to live on ice cream, I'm going to feel ill in my physical body, but I'm also going to feel ill in my mental body. So if I'm talking to someone who's in depression, we start looking at, how is it that they're feeding themselves? And not just feeding themselves food, but how are they feeding their senses? Are they looking at things that bring them into a greater sense of self? Are they looking at things that bring them joy? Are they looking at things that they're excited about? Are they listening to things which bring them joy and that they're excited about? Do they surround themselves with smells that enliven them? So when we find ourselves in a depressed state of mind, we might want to consider how is my external environment? How am I feeding myself through all those 5 senses? And then I mentioned before yoga and meditation. How am I feeding my mind? My mind is fed in silence. My mind is fed when it can fully digest everything I've taken in. Oftentimes I see people who are depressed and they can't take anything in. And so for them, I start by recommending exercise. And it's mild exercise. Just start getting prana into the body. We still have to breathe even when we're depressed. So we can make sure that when we're breathing in, maybe we're thinking a positive thought for the self. If someone gets to the point that they need antidepressants, then while they're on antidepressants, I like them to put into place Ayurvedic diet and lifestyle so they have coping mechanisms. So that when they come off those antidepressants, they're able to better tolerate the changes that are going on in their bodies and in their lives. Because sometimes they can't figure out what's happening because of these shifts.
Thank you, Mary. That must be helpful. And there are a lot of thank yous coming in for you from Teresa, Geraldine, from Krista, Gloria, Pam. They're all saying thank you to you. Okay, so one more last. We just got 1 minute to go, but we'll quickly cover this. I mean, there's just such a dearth of time. But, Jessica asks, is it possible to change your dosha by diet? And Deborah also asks, that she was once diagnosed when she was in her 30s. A practitioner told her she's a pure Vata, but now she feels she's Vata Kapha. So she asks, is it possible to change your doshas with age? Now, this concept of, with Jessica's first question about changing doshas by diet, I think there's something, the fundamental explanation of doshas needs to be established at this moment. If you could just answer.
Well, what's tricky is we have so many different things we call dosha. Your prakruti, your constitution is set. You can't change your constitution. That is who you are. That's like your genetic makeup. And so you can't go back and change. I can't go back and say, I'm no longer going to be this height. I'm going to be taller from now on. I can't make that happen because that's who you are. But dosha means fault, like the way in which you go out of balance. So I can change my dosha. I can change what's out of balance very easily. I could decide from this day forward that I'm just going to be more kapha. Many times as we age, we go through a kapha time of life to a pitta time of life to a vata time of life. So we could appear that our dosha shifts as well. When the woman had said that she was diagnosed earlier as Vata Pitta, but now she feels more Vata Kapha, one thing that I see is the question is asked, has she done many things to pacify the Pitta? So the Pitta is no longer as evident, and now she has more Kapha qualities. And I have to ask the question of, is the Kapha the problem or is it the solution? So in the body, this is the dosha, the Vata, Pitta, and Kapha are the tools the body uses to create balance. So if I get too light, my body brings in Kapha to bring me down. If I get too hot, I bring Kapha to cool it down. So it could be that her Kapha that she may feel now is a solution to the Pitta that she was experiencing before to bring her back into a state of balance.
Okay, another question coming in, but before I take that, there's something else that we really wanted to talk about, which was infertility. And I don't know if all of you got a chance to go through the video yesterday, but you will get a chance to watch it today as well. Mary herself, when she was about 34, she was told by doctors that she cannot have children, and that is something not only because of physical reasons, it causes physical trauma, but it is also emotionally very, very traumatizing. It debilitates you and makes you, even affects your will to do things. Mary, just before we leave, how did you really heal yourself?
Yes.
I now has a start. Yes, and how did she do it? How did you do it?
What's really interesting to me as well with Inajizek, so what Venu said is, I was told I couldn't have children at 34, and I never even thought about it really after that. I thought, okay, they told me I couldn't do this, so I didn't actively try to recover the health of my reproductive system, but what I did try to do was to pacify this huge Vata imbalance that I had created. And so I was repairing the strength. I didn't realize that I was even able to, because from Western standpoint, I couldn't recover the health of my reproductive system. And so, but I forgot that Ayurveda doesn't necessarily believe that any system is totally destroyed. If it's still there and it still has some vitality to it, you can reignite that vitality. So by recovering the quality of the dhatu all throughout the body, I recovered the capability of my reproductive system. And I'll confess that my pregnancy was a surprise because I didn't know that I had done that. I knew that I was still menstruating. I knew that I had all the signs that I should be able to get pregnant. But when I became pregnant, it wasn't because of any specific action I had taken, but a general Ayurvedic protocol of just regaining health. And what was amazing to me was that simply by putting into place the diet and lifestyle, I was able to regain the health all the way down to this core body system, the reproductive system. And so it was so wonderful for me.
Yeah, I think that's pretty, it's very commonly heard of that once people forget. What I think plays a part in it is that it reduces your stress or anxiety about doing something. If you're really worried about, conceiving, then it doesn't happen half the time because of the stress that you take for it.
Right. Mm-hmm.
And you recommend that stress is something, yeah.
And simply by wanting to regain the health of the whole body, I did. I was able to regain everything, and I didn't focus more attention on one part than another, but every body organ system was considered important.
Great. So I find it tough to leave this question out again, since it's the final day of the webinar and we're not going to be doing this again very soon. So just one more question. We're stretching it a little bit. Kabir here asks, often when I work with women who have just begun menopause with typical symptoms, I address their doshic imbalance in their reproductive system with herbs. Then their menstruation cycle returns. Can you comment on this and what this means?
So when she's working with women who are menopausal and she uses some herbs and then menstruation recurs?
No, she's saying, yeah, it does. It returns with the herbs, yes.
Mm-hmm. So typically in an herb like shatavari creates an estrogenic cycle and some of the herbs, in Ayurveda there's a category of herbs that are called rasayana. They restore the youth of the body. They're rejuvenatives. And so sometimes in the use of rejuvenatives, you can enliven and awake any of the follicles that may have still had viable egg or may still have some viable responsiveness to the hormones of the hypothalamus pituitary. If you bring that menstruation back, it's not typically going to be for very long, because typically their body is at that point where there'll be fewer and fewer follicles that can respond to that push. An herb like shatavari, I often see that effect as well, that it tends to bring on this estrogen, and the body's own progesterone tend to have, they go back into that reproductive response. And so you can get some degree of menstruation after. It's typically of short duration and very light. It's not harmful necessarily. However, it's kind of like we're doing with hormone replacement, of kind of managing hormones externally. And so along with the herbs that you're using, I'd recommend that they work with their lifestyle, do more exercise, so they can be working with the Dhatu Agni, so that they're building the strength of the Dhatu and not relying on the herb to build the strength of the Dhatu for them.
Okay, great. I hope that was helpful, Kabir. Mary and everybody, first of all, let me convey to Mary, there have been a lot of thank yous from Francesca, Jeanette, Olympia. Thank you very, very much for your warm appreciation, and thank you, Mary, for your, wisdom of years. Wisdom is not earned in, just through books. It's earned through your experience and your, the fact that you've been healing and helping and working with so many people for so many years. Thank you so much, Mary, for sharing this information, this wisdom with us. And I'd just like to remind everybody else that while these, we'll try and keep organizing these webinars as often as we can, you can also send in topics that you'd like us to cover, things that you're concerned about and you would like to have some expert opinion with, or would like to discuss those topics. Please send them to us and we'd be happy to organize them for you. Just before we go, Mary, about just a last note about your program. Why would you recommend it to people, and why would you request them to just, take a look at it? Because I would do that.
Well, thank you. I recommend it for all women because it addresses so broad of array of imbalances that they can experience, symptoms they can experience.
Sorry, Mary, you're cutting out a bit. Can you come again, please?
Yes. For women in their reproductive years, the program is beneficial because it talks about some common complaints that women experience during menstruation. And it gives you sensible and easily applied things you can do to try to offset the degree of symptoms. You can share this information with your families. When you have learned it or applied it to yourself, you might then be talking to someone and you can share information that you've gained, that's something that's benefited you. You can pass it on. I also think it's important for menopausal women to know that there is some ways to get relief from the symptoms that they have with menopause. And I do believe it's important for women who are in their reproductive years to be looking forward to menopause. It's not the end of the life, it's simply the end of the period. And so at that point, we can still have a lot of health if you just consider, how can I keep myself healthy enough to do this? For the men in your lives, it gives them the opportunity to understand a little bit more. I go into a lot of detail in the program about what's going on physiologically in your body from the Western standpoint. What's happening with the hormones? What's driving this hormonal imbalance? And then sensible application of treatments that you can do to bring it back. I've said it in the program, I said it in the introduction, but I feel really well qualified to talk about this, having gone through so many of these specific symptoms. But even more than that, I feel really obligated to make sure that you have this information. If you need this information, I want you to get it. I had lunch today with a woman who was my nurse midwife at my son's birth, and she and I were talking about how vital it is that women take control of their health. And for everything that you can do, you gain control of your own health, which affects the health of your family, your friends, your community, the world. And it's time.
Well, Mary, with all your experience and knowledge, it's commendable how humble you are, and just discussing this with you is a lesson in humility itself also. So thank you so much for that as well. Thank you, everybody. With this wonderful note, we end our session. We hope to see you soon, and we hope that this knowledge has helped you and your friends, your daughters, sisters, your families. It has helped you transform to better health. Thank you so much. Have a great evening. Thank you, Mary.
Oh, thank you so much. Thank you very much.
you will all be taken to the product page just right after this if you'd like to take a look at the program. Thank you.